All right, thanks, Brett. Well, good afternoon, everyone. Thanks for hopping on the call with us for our weekly update call. We'll go ahead and start with a review of the data. So, Jordan, I'll turn it over to you.
All right, I will start sharing my screen with the My Safe Start County data first. So you should be seeing that in just a second here if you're not already. And you can see that all of our counties are the same color, which means they're all in the E risk level, which is the highest risk level. So our cases per million and percent positivity do continue to increase overall for the jurisdiction, with percent positivity above 20% now, and almost all counties are over 300 daily cases per million besides Lake County. Outbreaks continue to emerge for us, and we have seen about a 50% increase in cases in the past week. Those cases were identified as household and community contact, schools, including colleges and daycares, pre-travel and post-travel testing, religious services, social gatherings, healthcare workers, care facility employees, and worksite exposure. Our total number of jurisdiction-wide cases as of yesterday was 14,994. So today we have reached and exceeded our 15,000 case mark. Cases by county as of yesterday are 753 in Crawford. Kalkaska has 791, Lake 439, Manistee 880, Mason 1,431, Mecosta 2,334, with Ferris State reporting 679 cases, Misaki 996, Newaygo 3,323, Oceana 2,034, and Wexford 2,013. In the past week, there were 10 deaths reported and 258 people who recovered. Yesterday, there were 17 positive inpatient cases at Munson Healthcare Cadillac, 14 at Munson Grayling, 1 at Munson Manistee, 12 at Spectrum Health Big Rapids, 6 at Spectrum Health Gerber Memorial, and 8 at Spectrum Health Ludington. So to move on to the better news, which is our vaccine update. District 10 is in blue, and the rest is just all of our counties according to the state dashboard. So according to that, 47,531 people have completed their vaccine series so far in our 10 counties.
All right. Any questions for Jordan? All right, we will send this information out to everyone after our call today. As Jordan indicated, we are seeing an increase, pretty significant increase in number of new positive cases in our jurisdiction. A large chunk of that is being fueled by the variants, kind of what we had expected. If you guys remember, we had shared some information. We had Dr. Morris on earlier when we were doing our update calls, and this was probably back maybe in January or so, and she had shared some information that was looking out into the future, and at that time was projecting that by March or April we would be seeing the variants being the dominant strain of the virus in our area, and I think we're starting to see that in the impacts of it with the increase in new cases. So that has kind of unfortunately held true. We know that we have seen some increases in hospitalization rates in our jurisdiction associated with this, and so primarily as a result of the increased role that the variants are playing. Earlier this week, the state did change the quarantine guidance, and they went back to an across the board 14-day quarantine period for everybody. And so moving forward, for us really moving forward as of Wednesday, we did implement that 14-day quarantine period for anyone who was identified as a close contact. And again, that is across the board. It may take us a little bit of time to get everything updated. and changed on there. We also know that they're trying to make that change with the state helpers that are helping us with case investigation and some of our contact tracing. So hopefully, we're not, the fear is that there's going to be some mixed messages out there, but just so that you guys know, it is 14 days across the board is the quarantine period now for those that are identified as close contacts. Related to individuals who are fully vaccinated, individuals who are fully vaccinated, if they are identified as a close contact, they do not have to quarantine. So that is a good incentive maybe for some people to get vaccinated in our communities. Jordan had shared some of the vaccination data that we're seeing. Related to vaccination, what I can say in some of our counties, we are kind of hitting a plateau where we're finding it a little harder to fill clinic slots. Some counties it's real easy, we can fill them up in no time. Other counties it's becoming a little more of a challenge. And so in some of those smaller counties, like Kalkaska, Crawford, Lake County, Missaukee County, I should say, we have pulled back to one first dose clinic a week and then a second dose clinic. And, we will probably continue with that unless there is demand for additional first dose clinics. For our first dose clinics, we are still predominantly using Pfizer vaccine and Moderna vaccine, although we will begin to work in some of the Johnson & Johnson vaccine that we have. We prioritize that initially for the homebound population, for shelters, both men's and women's and homeless shelters, and then also for the jails. So we are working through in each of our counties to get our jail population vaccinated. Some of those counties were a little farther ahead than the others, but we are trying to work through that. Unfortunately, we have had some issues with some of our staff who have been off because of being positive and or having to quarantine as a result of an exposure. So, we're no different than many other work sites and in experiencing those issues. But we're getting back to a point now where we should be getting everybody back. And so, for those counties that we have not gotten to the jails yet, and I should mention some of those counties, actually, we did have outbreaks in. So it's going to be a little bit longer for those before we can get in there and vaccinate them. But we will reach out. So if your county has not been contacted yet regarding working with the jails, let us know. And, we'll see about, making that connection so that we can get them vaccinated. We do intend to use, again, like I said, Johnson & Johnson, so that it'll be one dose and done. We won't have to go back in for a second dose. And then we'll begin to work that Johnson & Johnson into our community clinics. Our first dose clinics, our clinic this week, we just did 2 second dose clinics. We did a second dose clinic on Monday, and then we have another second dose clinic on Saturday in all of our counties. And then next week, this will be the last week that we'll have this type of a setup where we do first dose clinics on Wednesdays and Fridays, and then second dose clinics on Saturdays. Next week will be the last time we do that. The following week, we will start the process of doing our first dose clinics on Tuesday and Wednesday, and then second dose clinics will be on Fridays. And so our thought is in starting to work in that Johnson & Johnson vaccine for maybe one of those first dose clinic days. That will make a smaller second dose clinic and a little bit easier with location wise as well as staffing. If we don't have, if we're not having to deal with 700 people coming back and only 350 people, it does make a difference in terms of locations and staffing that we need to operate those clinics. So thinking that will help us. Also, as we look at and experience kind of that pullback because of renewed interest in being vaccinated, we will spend some time looking at exploring getting out to out county type locations. And so if there's some of the smaller communities where we haven't gotten to yet, or where we may find and identify people who would like to be vaccinated, but for whatever reason have not come into our office or one of the other sites to get vaccinated, then we should be able to go out and do these smaller clinics in those community settings. So we will be looking at trying to do that, and then at some point, eventually, probably getting to the point where we'll operate our vaccine clinics much in the same way that we do our regular immunization clinics. We'll just have them in our office, and people will be able to schedule in, and we'll vaccinate people that way. I know in talking with some of the other health officers across the state, they are envisioning that probably by the end of May, they think they may be done with their larger mass clinics, and will be transitioning to these smaller, whether it's outlying clinics or clinics in their offices, just like they do their normal vaccination clinics. So I think for us, we'll have a better idea of what our May and June will be looking like as we get to about the middle part and towards the end of this month. And I'm guessing that will probably be very similar to what they are based on what we're seeing now. In some of our counties, actually in a large chunk of our counties, we do not have much of a waiting list any longer. We've gotten through pretty much everybody on there. And so at some point, we won't have anybody else left to call. And so there will be, that will be a challenge and present a different challenge to us in terms of assuring that we can get rid of vaccine. So those are just some of the things that we're facing. I think the other thing that we're looking at doing is kind of acknowledging all of the volunteers that have helped us. The week of April 18th is National Volunteer Week, and I think it's the Wednesday of that week is actually National Volunteer Day. So we are trying to put together something to acknowledge all of the volunteers that we've had that have helped us out. And we have had many volunteers who have worked with us and helped us to accomplish what we have accomplished so far with our clinics. And so, we're trying, we're working right now to try to do a small acknowledgement of them, a thank you note and somewhat of a gift card, but it will not be, any amount on a gift card is not going to be enough to thank them for everything that they have done. We've had some that have volunteered for us once, twice, three times, and we've had others that have volunteered many, many more times than that. And again, without them, we could not have accomplished what we've accomplished so far. So we will be trying to acknowledge all the volunteers, and that's another thing that we are working on as it is right now. Other than that, really most of our time right now, because of the increase in cases, is really being driven by case investigation, contact tracing. Really, the prioritization for new cases is younger folks, so the school age individuals, and that takes a considerable amount of time to deal with. And then vaccination clinics. Those really are our priority areas that we're working on right now. We know that frost laws have come off some of the roads and they'll be coming off some of the others. So that is going to pull some of our staff away because they will be pulled into well and septic work that they'll have to do, which is going to put a little more of a strain on us. But, we will still do what we need to do to put vaccination clinics opportunities available and out to individuals in the community. We do continue to partner and meet with our health system and hospital folks on how things, to try and make sure that we're not tripping over each other and to have somewhat of a coordinated approach to doing vaccination clinics in our communities. And those meetings, have gone very well and continue to go very well. The other thing the other change that's happening now, and this is kind of the first week of it where we're kind of in the planning stage for it, but versus the state providing out vaccine to all of the providers in the community, the state is going to push a chunk of vaccine out to the health departments, and then we will reach out to those partners and identify how much vaccine they may be interested in getting, and then we would be more of the driving force behind distributing vaccine to those providers. So we've done that. We did have to submit in paperwork and an idea of which providers in the community wanted to get vaccine and what their plans were for distributing it. And so that vaccine should be allocated beginning next week, and then that will just be a weekly process that we will go through. We're kind of waiting to see what that what those allocation amounts are going to look like. As I shared with you, I think we didn't have a call last week, but the week before that, the amount of Pfizer and Moderna vaccine that we're getting, they believe has peaked. So that amount will pretty much stay the same. Any increase will be in Johnson & Johnson and or any additional vaccine that may get approved for emergency use in the future. And I'm not quite sure what's going to happen with anything on that. We do know the current epidemic order does expire on the 19th of this month. So we're kind of waiting to see what, if anything, is going to come of that. We're here, and I've not heard anything, so I can't tell you anything other than, I've heard comments in terms of there's not an expectation that any further restrictions are going to be put in place. So I don't know what that means, but that's kind of one of the things that I've heard. I also believe that as of the 14th of this month, the MIOSHA guidance that dictates a lot of the requirements and expectations for the work sites will expire. So waiting to see what, if anything, new or continued that MIOSHA may put out there. Specifically, around the masking and fully vaccinated, if any of that will change from MIOSHA. Right now, CDC guidance related to individuals who are fully vaccinated and not having to wear masks or socially distance really revolves around residential, those individuals in residential type settings, not workplaces or businesses. But again, the guidance itself is changing pretty rapidly related to being fully vaccinated. So we're kind of waiting to see what, if any, new changes will come from that. So kind of a lot of pieces that we're sitting waiting to see what's going to come of them, and then move forward as a result of that. And as I said, I don't have a lot of insight into that. Sometimes we don't hear about it until you guys hear about it. So which is not always fun, but that's kind of how it's worked. So that, I believe, is the information that I have to share today. I don't know if Brett or Jordan have anything else that they would like to share.
Nothing for me.
Okay.
I think just to mention that we were trying to switch to the weekly update for some of the data. And then we got some feedback that people still want to see it daily. So we've made a compromised and simplified version of our daily data update. And that will be out on a daily basis, Monday through Friday. And then the rest of the data that we have been providing since the beginning will all come out on Monday, and that includes the data dashboard.
Thanks, Jordan. All right. Other than that, how about questions, if there are any that you guys have? All right, Kevin? You have a question?
I do. I'm wondering, would you mind if I shared my screen for half a minute or so?
No.
All right. So first of all, hi, everybody. This is Kevin at KMHC. I do want to share my screen. This is a data set that Munson provides each of the hospitals every single day. Can you see the two graphs?
Yep.
Well, the graph on the top is it's a plot of inpatient cases throughout Munson Healthcare, and as I think you can see with this upper graph, we have exceeded the prior peak in inpatient hospitalizations that occurred back in November and December. And earlier this week, we actually had 99 COVID patients throughout the Munson healthcare system hospitalized. And this is a very, very, very significant concern, at least for our hospital providers. So I wanted to kind of share that a little bit with everybody. with beds are tight, staffing is tight. We are very, very concerned about the continued increase. So the first thing I kind of wanted to do was just kind of share that information with everyone. I hope I have just released the screen. So
Yep.
okay. And I guess my other question, kind of a related question, is with this rise in COVID cases in northern Michigan, and you can pick up all the news media that Michigan is having really the most significant increase in the United States. Do you anticipate any further restraints coming out of Lansing? And I guess in addition to that, we are entering the period of local festivals and large outside gatherings, and I'm just wondering if District 10 has any advice on. I know in Kalkaska, I mean, we've got just a couple of weeks for Trout Festival.
Trout-rama.
Yeah, and we're really, really concerned about it, and just wondered if there was any advice from District 10.
Yeah. We were on. I mean, I was on a call with representatives from the governor's office yesterday, and there was not any. There was a question was raised in terms of is it envisioned that there may be some further restrictions coming out, and there was nothing. Nothing was shared from them in terms of there may be. I'm not. So I don't know. That's. We're not hearing anything related to, wanting, looking to put in place any further restrictions. As a matter of fact, on a call last week, Friday, with the MDHHS director, the local directors really were pushing, or I don't want to say pushing, but really were trying to, encourage more in the way of local control or local orders over some of those things. And that in and of itself kind of generated some pushback from the few local health departments that were on that call, because doing things county by county really is difficult to do, because all you do is you push it from one county to another. And so I think with some of the events that are going to be planned, we have existing capacity limits that are in place right now for outdoor events. I know those have been shared with some of the entities that have reached out from Kalkaska specifically on it. The biggest issue and concern, at least for me, and I know for many of our other health departments, is we can put a local order in place that would limit gathering sizes and things like that. The struggle and the problem is to be able to enforce it. And because there really is not an appetite right now to assist or to help in any enforcement of some of those things. That's kind of the biggest challenge that we have. I mean, I can go ahead and issue an epidemic order based on the data that we have, and but at the same time, if I can't enforce that order, it's kind of like, well, has it really done any good? I mean, inevitably, I fully expect that I will get, at least a dozen, if not more, calls from individuals in Kalkaska as a result of the Trout Festival, inquiring about, okay, these large gatherings and all this and everything that's going on. Because that usually happens. I mean, it happened last year. I'm envisioning it's going to happen again this year, and that's not just limited to Kalkaska. It's limited really to any of the other counties that are in our jurisdiction. Unfortunately, even with additional or further restrictions from that let's say may get included in an epidemic order, it's kind of the same. We run into that same thing when it's, it falls upon trying to enforce some of those things. And if that enforcement falls upon the local health department, it makes it very tough to try to go anywhere with it, especially if it requires we have to loop in, law enforcement and or the courts to try to get to the point where we want to get. So, I mean, that's the answer I have for you, Kevin. It's not a good answer, but it's kind of the reality of the struggle that we face with doing that.
Yeah, gotcha. And I agree. I mean, there is no right or wrong answer. You just hope that we don't shoot ourselves in the foot.
Mm-hmm. Yeah, I mean, I know my wife is, and I've said this before, my wife is a nurse here in Munson Cadillac Hospital and has been taking care of COVID patients. So, I mean, I know the numbers that they've had. Munson has seen an extremely high increase in COVID positive patients. So our southern hospitals, and I don't know, Jordan, did you provide hospitalization data and I just missed it?
Yes, I did at the end.
Okay.
I think it was 12. I want to say 12, 8, and 6, maybe.
For Spectrum or for a month?
Yes,
for
Spectrum.
Yeah, so even those, are starting to kind of see an increase in cases too. So it is something that we're monitoring and trying to keep a handle on. The other piece, I mean, really right now, most of our efforts really revolve around, as I said, case investigation, contact tracing, and vaccination. And sometimes, we don't have as many bodies as what we'd like to have to be able to do it, especially on a clinic day when we have vaccination clinics going. We sometimes only have 3 or 4 people that are doing case investigation or contact tracing, and we know we can't do a good job with that. Although I think we're kind of at the point now where most people know if you're positive, you need to isolate for 10 days. If you're close contact, you need to quarantine for 14 days. But still, being able to contact somebody and answer questions that they have is all part of this education process and trying to keep a handle on it. So yeah, a lot of moving pieces and no good answer in terms of trying to put the genie back in the bottle, so to speak.
Great. Thank you, Kevin.
Yep. Other questions? No? All right. Well, that's all that I have. Although Gwen, I see you're on. Is there anything that you would like to share regarding your group's vaccination efforts?
Yeah, so we are wrapping up a special vaccine allotment that we received to target social vulnerable index areas. And today we're doing an event in Shelby. It has been challenging to fill all the slots. So I was kind of curious, Kevin, you mentioned that in some of the other counties. I'm wondering about Oceana, if you're feeling like we're just really saturating at this point, or what more we can do about vaccine resistance.
Yeah, I've not heard specifically on Oceana County, but I can check and let you know, Gwen.
Thanks. Yeah, it just has been really challenging to push that 1,000 doses out within the time frame that we needed to get done. So we're super close to finishing that up, and from this point forward, we'll be doing some curbside vaccination, and our efforts are going to be focused around doing migrant camps. So we'll actually be going out to the camps and doing that for residents in camps. So
Okay.
We're looking forward to things stabilizing a bit after we finish this big push.
Okay, thanks, Gwen. Okay, and then probably in addition to Gwen's group, Baldwin Family Healthcare or Family Healthcare is also getting vaccines. So I know they're working out in the communities, and then most of the major pharmacy chains now, Myers, Rite Aid, Walgreens, those also are getting vaccine and are vaccinating out in the community. So in most communities, there are multiple options and opportunities for people who want to get vaccinated to be able to get vaccinated. We're starting to see now, probably more so at this, well, maybe another couple week or so, we'll begin to see the snowbirds begin to come back. And so kind of watching to see how many of them who may have gotten their first dose of vaccine down there are going to need a second dose. And then looking at trying to be able to, accommodate that and provide them with vaccine. And again, hopefully with the FQHCs, the pharmacies, and the health departments and other providers that are doing it, we'll be able to provide anyone who wishes to get vaccinated with a vaccine. So, anything else from anyone that you'd like to share? Okay. If not, then that's all that I have for today, guys. We'll get, we'll plan on reconvening next week, Thursday. That would be the 15th. So by then, we'll know what if anything new is going to come out. If anything new is going to come out regarding epidemic orders, and maybe should also know on the myosha stuff too, so we can chat a little bit about that. And otherwise, last chance, if anybody has any questions, or if you think of something afterwards, go ahead and email it to me. Otherwise, if it's a day or two from now, you think of something, go ahead and email it to me, and I'll get a question and I'll get an answer, and then we can share it with the group next week. If not, thanks guys for taking time to hop on the call with us today, and we'll get back together next week, Thursday. Have a good weekend.